First, my story is a very common one. I'm George Foster. I was a businessman in the interior design industry, which came to a sudden end. In 2014, I was admitted to the emergency room. I had had several strokes. I was extremely frightened. I felt as if everything had come to a halt in my life. I had right side paralysis. I didn't understand how I had gotten there. Then when I realized I was here, I didn't understand how I was going to pay for it.
So I'm Darylyn Smith. I am a Houston native. I am co-founder of Lifelong Nonprofit, and it's a nonprofit to help raise awareness regarding lung disease. My father passed away from lung cancer, so I completely understand the things that come with that. So that's why we founded Lifelong, to help people like my dad.
Mi nombre es Marco Vinicio. I developed leukemia, ALL type, back in 2014 in December, but I wasn't diagnosed until January 2015. I have a business regarding nutrition habits, and nutrition care.
Hi, my name is John Zilker. In my career, before I ended up being sick in the last year, was primarily in business management, and what brought me to the hospital was cirrhosis of the liver. I got taken to the immediate hospital near my house, which was a for-profit hospital that the ambulance took me to, and they didn't have a specialist for the livers there. I started working with my resident in charge of my care, and he immediately recommended that I come and see LBJ and work with the specialists here.
I had 2 hip replacements. The first one, I was very concerned about, oh my God, is my leg gonna fall off when I go to stand up? The nurse came in and could see how uncomfortable I was, and began to take pillows and pack them around me and to help me find a position that I could achieve some rest. And that meant a lot.
I remember when they intubated him, my grandfather was crying, my sister was crying, my dad, he was nervous. You could just see in his face. He was looking at me, and I just was rubbing his head, talking to him. I got to climb in bed with my dad, literally. Physically, I climbed in bed with my father and held him and talked to him as they took him off the machine. I remember one of the staff members the doctor was there to call it. He didn't ask me to move. He listened to my father's heart and called it. And I didn't realize how important that was, that he didn't prematurely break me from my dad. So I appreciated that last moment to just break away from him at my own pace.
So the care team that I had, honestly, it was amazing. From each doctor to each nurse. The nurses are incredible, to be honest with you. Of course, the doctors are too. But the nurse care that I received, they would really care for every detail and made me feel human and not just a patient with a number. But the fact that I felt the warmth from every team member made me fall in love with the hospital.
The number one thing I'd like everyone to know about LBJ and the Harris Health System is don't judge the book by the cover. So many people like myself had only heard of LBJ and Ben Taub as examples on the news. You know, this criminal that got shot by the police ends up at this, at Ben Taub's emergency room. And you hear about all these horrible things. So it formed a picture in my mind before I ever came here that the care was subpar, it was going to be dirty, you were going to get the people that weren't good enough to be at the other hospitals. And what I've found is it's just the opposite. From the different nurses that do the procedures along with the doctors, it's nothing but positive.
I think the angels are right here, right then. And those were my doctors, my nurses, the care team. It's just been a very touching and learning moment. I'm very grateful for the care team. I'm grateful for every single person that works in the hospital, because every time I was here, even afterwards, they always receive me with a smile. So I thank God for that.
I think the primary reason that I volunteered with the PFAC committee, the Patient Family Advisory Council, is because I wanted to give back. I wanted to let the people know who took care of me that I want to help them take care of other people and help eliminate some of the barriers that patients feel and how we see things, so that the staff can better understand what our needs are and what we're trying to achieve. And I know that going through all of these treatments, I became a much happier person. I became a healthier person. I mean, I can move with these new hips. And that's the whole thing. It's just a very dynamic opportunity to live again. And I couldn't have done that without all the skill, all the caring, all the support, all the different disciplines. I could only shudder to imagine what nursing home I would be in today if I hadn't come to LBJ.